KIFAD is an NGO providing care and support to people living with HIV in this community. To date, we have tested slightly above 300,000 people, and we have supported them to know their HIV status. We started this health clinic with the support of our partners from KIFAD UK to support the communities to have increased access to HIV treatment, care and support services in this community.
We call KIFAD Medical Clinic a child of KIFAD, an organization. KIFAD Medical Clinic was started 1 year and 8 months back here in Bulabakulu due to a health gap which was identified by KIFAD, the mother organization. Some of the reasons as to why we thought it very wise that we have this clinic established. One was lack of a public health center within this remote area. Secondly, lack of public means of transport for clients to traverse to the nearest health center, which is 5 kilometers from this distance. And the vulnerability of the community itself prompted us to establish this clinic. KIFAD Medical Clinic handles lots and lots of cases within this community of Bulabakulu, and to summarize it all, we do general checkup of the clients, basic primary health care, we do immunization, we do reproductive health, we do HIV testing and counseling, we handle lots of skin diseases within this community, bacterial infection, we have pneumonia, and quite many other diseases.
First of all, we face a challenge of mothers being ignorant about coming to the hospital for antenatal checkups, to deliver in the hospital. Why? Because some of them are taken up by the TBAs, the traditional birth attendants, which puts them on a threat of losing their life. So I think through sensitization carried out to the community in the upcoming time, these people will be sensitized enough, will have the knowledge to know that they should come to KIFAD Medical Clinic, have deliveries, and for their well-being. Then also we are facing that challenge of being understaffed here. We don't work 24/7 due to the problem of power and some medical equipment that are needed to do all that.
At KIFAD, we ensure we test a number of people every month. In general, we test around 1,000 people every month, and on every 100 people we test, we have at least 4 positives. After finding an HIV positive person, we ensure that person is linked, we follow them up to ensure that they start treatment, which is free here in Uganda. As KIFAD, we are mandated to work in Wakiso district on behalf of Uganda Cares, but Wakiso district is very huge, so the demand is too high compared to what we can manage. So you find that we have a number of people who need to be tested, but of course we cannot test everyone because we have little funds to cater for that. We work with key populations such as men having sex with men, sex workers, fisher folks, drug users, uniformed personnel, and other categories. So sometimes it is very difficult to work with these people. They are very mobile. The community doesn't welcome them, they don't embrace them, so sometimes it is very difficult to support them, to link them into care. Today they are working from Wakiso, tomorrow they go to Uyikwe, they go to the learning site, so they keep on moving, and yet they cannot get treatment easily anywhere.
The FIT-TB is a program that works on tuberculosis, where it specifically aims at tuberculosis case identification and strengthening referrals and treatment outcomes from TB patients. We specifically target certain populations, for example, people living with HIV/AIDS in the communities, and also we target people living in congested areas, for example, slums, prisons, schools, bars, brothels, people that live in such congested areas.
I wish to acknowledge and appreciate the great support from our partners, KIFAD UK, from AIDS Healthcare Foundation, locally called Uganda Cares, to our international volunteers who have really supported us to ensure that this health clinic is operational.
era buli ekinnuma nzirukira wano ne banzijanjaba ne bankolako bulungi keyaweeri.
I've been getting medication, I've been getting clothing and other things.
When I came for the treatment, they treat me very nicely.
It has also helped me by giving me guidance, medication. What I can say is that thank you, please, thank you so much.
Amidst the challenges we as KIFAD we face, I probably wish to call for any donations from whoever can so that we can enhance implementation of our activities.